Have you ever wondered why you start sneezing when spring arrives? Or why your skin gets itchy after petting a dog? Maybe you've had a mysterious rash, a runny nose that won't quit, or red, watery eyes that make it hard to get through the day. If you've ever experienced these symptoms, you might be dealing with an allergy, and you're not alone. Allergies are incredibly common, affecting millions of people around the world every year. They can make daily life uncomfortable, and in some cases, even dangerous. But how do you know exactly what's causing your allergies? Is it pollen in the air, dust in your home, something in your food, or maybe even a new soap or lotion? Pinpointing the source of your allergy is the first and most important step to finding relief. That's where the allergy skin test comes in. A simple, safe, and effective way to discover the triggers behind your symptoms. Imagine a test that can help you unlock the answer to your sneezing, itching, or breathing difficulties. In just a short visit to your healthcare provider, you can get valuable information about the substances that bother your immune system the most. This knowledge empowers you to avoid or manage your allergies and feel better every day. Let's explore how an allergy skin test works, why it's done, and what you can expect if your doctor recommends one. Whether you're curious about your own allergies, worried about your child, or just want to understand more about how allergies are diagnosed, this information is for you. An allergy is your immune system's overreaction to something that's usually harmless, like pollen, dust, or certain foods. When your immune system thinks these substances are a threat, it goes into action, causing symptoms like sneezing, itching, rashes, or even more serious reactions. Allergy skin tests help find out exactly which substances, called allergens, are triggering your symptoms. So, what happens during an allergy skin test? The test is usually done in your doctor's office or by a specialist called an allergist or dermatologist. There are a few different types of skin tests, but the most common is called a skin prick or scratch test. During this test, your provider will put tiny drops of different allergens, like pollen, pet dander, or dust mite particles, on your skin, usually on your forearm or back. Then, they'll gently prick or scratch the skin under each drop. If you're allergic to any of those substances, your skin will react by getting a small red bump, like a mosquito bite, in that spot. Another type of test, called an intradermal test, involves injecting a tiny amount of allergen just under the skin. This test is often used for allergies to insect stings or certain medicines. There's also the patch test, where patches containing small amounts of allergens are placed on your skin and left for a couple of days to see if you develop a reaction. Each method is chosen to best match the type of allergy your doctor suspects. Why might your healthcare provider recommend an allergy skin test? If you have symptoms like a stuffy or runny nose, sneezing, itchy or watery eyes, hives, rashes, diarrhea, vomiting, coughing, wheezing, or shortness of breath, and especially if these symptoms keep coming back, an allergy could be the cause. Finding out exactly what's triggering your symptoms can help you avoid those substances and get the right treatment. For example, knowing you're allergic to pollen can help you manage your time outdoors during allergy season. Or, if you're allergic to a certain food or animal, you can take steps to limit your exposure. Getting ready for an allergy skin test is simple, but there are a few things to keep in mind. Some medications, like antihistamines or certain antidepressants, can affect your results, so your doctor might ask you to stop taking them before the test. If you're getting a patch test, you might need to avoid sun exposure or tanning for a couple of weeks beforehand. Your healthcare provider will give you clear instructions to help you prepare. The test itself is quick and usually not painful. Most people describe the pricking or scratching as a tiny pinch. You might feel a little itching or see some redness where the allergen is placed, especially if you're allergic to it. These reactions are normal and usually go away soon after the test. In rare cases, a stronger allergic reaction can happen, which is why the test is always done in a medical office where help is available if you need it. After the test, your provider will look for signs of a reaction, like red bumps or swelling, at each test site. If you have a reaction to a certain substance, the test is considered positive for that allergen. The size of the bump or rash can also help your doctor understand how sensitive you are. If there's no reaction the test is negative, and it's unlikely you're allergic to that substance. With your results, you and your doctor can work together to make a plan. This might include avoiding certain allergens, taking medications to control your symptoms, or in some cases, starting allergy shots to help your body get used to the allergen over time. The allergy skin test is a powerful tool. It gives you clear answers and helps you take control of your health. Allergy skin testing is safe, effective, and backed by science. It's an important step in understanding your body's unique responses and finding solutions that work for you. If you've been struggling with allergy symptoms and want to get to the root of the problem, ask your healthcare provider if an allergy skin test is right for you. By understanding what your body reacts to, you can take simple steps to feel better, whether that means swapping out your laundry detergent, keeping windows closed during high pollen days, or changing your diet. The first step is finding out what's causing your symptoms. The allergy skin test is here to help you do just that. So, if you're ready to say goodbye to sneezing, itching, and guessing games, the allergy skin test could be your answer. Take the first step towards feeling better by learning more about this common and effective test. Your journey to clearer answers and healthier days starts here.